One of the biggest decisions that you have to make about Medicare is should you enroll in a Medicare Supplement plan or in a Medicare Advantage plan? Now here's the thing. Medicare's official website just does not do a good job of explaining the actual differences between these two.
What's the difference?
What's the difference?
Which is very unfair for you, the consumer. And if you turn to YouTube, you'll find that most channels are either pretty shallow or extremely biased towards Medicare Supplement plans. That's why I am here. Not only to give you a complete side-by-side comparison of Medicare Advantage and Medicare Supplement plans, but I'm going to do it without the bias against Medicare Advantage that you see in most other videos. Because there's a reason why 54% of people with Medicare choose a Medicare Advantage plan, and that number is constantly going up. There's a place for both of these two types of plans. So in this video, we'll look at the 7 key differences between these two plan types and give points based on which one we feel is better for each category. Now before I jump in, I just want to say 2 quick things. First, this is going to be a very thorough breakdown video. We're going to look at the 7 differences between these two plans so that by the end of the video, you'll have a much better idea of which one is best for you. And second, for this comparison, I'm really going to be comparing Medicare Advantage plans to the most popular Medicare Supplement Plan G. Medicare Supplement Plan G is by far the most popular Medicare Supplement plan today, and it's a good representation of the strengths of a Medicare Supplement plan when you compare them to Medicare Advantage plans. Let's start with the foundations. You can't really grasp the difference between a Medicare Supplement plan and a Medicare Advantage plan if you don't fully understand how both of these plans work in the first place. Both Medicare Supplement plans and Medicare Advantage plans are provided by private insurance companies. They're both designed to help you with the out-of-pocket spending costs with original Medicare. Medicare Supplement plans do this by acting as a secondary insurance plan to original Medicare. This means that they simply cover the gaps that exist in original Medicare. So original Medicare will pay about 80% of your healthcare bill, but instead of passing the remaining 20% straight to you, it goes to your Medicare Supplement plan first. Then your supplement plan pays their share before finally passing the bill to you if necessary. Sometimes when the bill gets to you, you won't even have to pay anything anymore because the Medicare Supplement paid all of the costs that weren't paid by Medicare. But we'll take a closer look at that in just a minute. Now Medicare Advantage plans are a bit different. They're not secondary insurance to original Medicare. Instead of being second to original Medicare, they actually replace original Medicare, as it were, with an insurance company Medicare plan. Instead of original Medicare paying your healthcare bills, your insurance company is now going to do that instead. So essentially what happens is when you enroll in a Medicare Advantage plan, Medicare gives your insurance company a fixed amount of money and says, okay, this money should take care of this person. That's why Medicare Advantage plans are required to cover everything covered by original Medicare. But aside from that, they can also provide a lot of additional coverages and perks. They usually have built-in prescription drug coverage, and many of them can typically charge a really low price or even a $0 monthly premium. And if you go to your doctor or hospital that's in their network, then the cost can be very low. Now, I'm not really going to give a point here to one side or the other on this one because there's no such thing as a better plan when it comes to the way that these plans work. They're simply different. So I'm going to say on this one, it's a tie. Okay, now that we know how both plans work, let's take a closer look at how it plays out in practice. One of the first things that you look at when choosing a plan is how much is it going to cost you? But for premiums, I'm going to straight up give the point to Medicare Advantage plans here. And let me show you exactly why. Okay, let's check the Medicare Supplement Plan G premiums for a 65-year-old man who lives in Houston, Texas. Now keep in mind that plan premiums can vary greatly depending on where you live. And if you live in somewhere like New York, for example, your premium generally is going to be a lot higher than if you live in some other part of the country. But okay, the cheapest Medicare Supplement Plan G for a 65-year-old male in Houston is $132 a month. Now remember, this is the lowest price. The average plan in this area costs around $150. But even if it's just $132 a month, keep in mind that with Medicare Supplement plans, they go up for your age every year. So that is going to increase when you're 66, 67, 68, all the way to the end of your life, it will increase. So if we check the lowest price for a 75-year-old male, we find that it's gone up to $165 a month. In some areas, the premium increases will be much higher, while in others, it could sometimes be similar to this. But keep in mind that Medicare supplement plans are cheaper at age 65 and they get more and more expensive as you age. Not only that, but also remember this guy still doesn't have prescription drug coverage yet. Medicare supplement plans don't cover anything that original Medicare doesn't cover. So this guy still needs to enroll in a standalone prescription drug plan or he will have a penalty. Now, premiums vary for prescription drug plans, but the national average for 2024 is around $34.70 a month. Now, lastly, if you have a Medicare supplement plan and a Part D prescription drug plan, you're still paying for your Part B premium, which costs another $174.70 for most people. So if we add all of that up, we'll see that someone from Houston who gets their cheapest Plan G and an average Part D prescription drug plan already has to pay $4,096.80 every year, even if they never go to the doctor. Now let's compare that to a Medicare Advantage plan. If we check the Medicare Advantage plans available in Houston, you'll very quickly find that most of them have a $0 monthly premium. And this is not only a Houston thing. A lot of Medicare Advantage plans all over the country have a $0 monthly premium. There are some plans with higher monthly premiums, but you'd be hard-pressed to find any as expensive as a Medicare supplement. Another great thing is that you'll find that most Medicare Advantage plans already have prescription drug coverage built into the plan, meaning you won't have to pay a separate premium for that. Now, before you get all excited and think Medicare is going to be free if you choose a Medicare Advantage plan, you should know that you still have to pay your Part B premium, which is set at $174.70 in 2024 for most people. But it's still a pretty good deal. Instead of paying 3 different premiums for Medicare, you only have to pay one. This is why if you never have to go to the doctor in a year, your expenses will only come out to $2,096.40, which was your Part B premium. Now that is a lot less than the base premium costs for a Medicare Supplement Plan G. That's why the point for this round easily goes to a Medicare Advantage. And this is really one of the strongest reasons why people choose Medicare Advantage plans in the first place. A lot of people simply can't afford $4,000 a year, especially because they still have to pay that amount even if they're not going to use their plan. But okay, let's not be biased. If premiums were the only thing we were looking at, this would be a very biased comparison. That's why we need to go deeper and take a look at how Medicare Supplement and Medicare Advantage plans do cost sharing. So whenever you go visit the doctor or you get some treatment or service, you typically have to pay a deductible, a copay, or some coinsurance. Now with Medicare Advantage plans, they set the payment terms for the cost sharing. Remember, when you enroll in a Medicare Advantage plan, your insurance company is the one responsible for your healthcare now, not the government. That's why they can set their own deductibles and copays for the items and services, and that's also why cost sharing varies greatly from plan to plan. Now the good news is all Medicare Advantage plans also have what is called a maximum out-of-pocket limit. Once your out-of-pocket expenses reach your plan's out-of-pocket limit, your plan will cover you 100% until the end of the year. So if we take a look at the Houston example, you'll see that the maximum out-of-pocket limits in this example are set at more or less $4,000. Again, I just want to stress that this is only for this specific location. The average maximum out-of-pocket limit is going to be higher in some areas and much lower in other areas. So when it comes to Medicare Advantage, we always have to look at your specific area. Now, if we take a look at Medicare Supplement plans, and particularly at the Plan G, we'll find that the cost sharing is much lower. The reason for this is because of how Medicare Supplement plans work in the first place. They're secondary insurance to Medicare. So Medicare pays first, then passes the bill to your supplement plan. And it's only after your supplement plan pays that a bill comes to you. Now, if we have a look at this chart here, you'll see that Plan G actually covers almost all the gaps in original Medicare except for the Part B deductible. This means that once you've paid the Part B deductible for the year, which is set at $240 in 2024, the rest of your items and services should already be covered by your Plan G. So you can see why this plan is very popular. Yes, the premiums are going to be much higher than a Medicare Advantage plan, but with a Medicare Supplement Plan G, there's very little cost sharing that you need to account for. And that's exactly why I'm giving this round's point to Medicare supplements. Okay, now when it comes to prescription drug plans and the benefits for dental, vision, and hearing and other things like that, which side is going to get the points? Well, if you've been paying attention, you can probably already guess, but let's dissect it anyway. It goes back to how both of these plans work. Medicare supplement plans are secondary insurance to original Medicare. So whatever original Medicare covers, Medicare supplement plan covers. Whatever original Medicare does not cover, a Medicare supplement plan does not cover. That's why if you choose a Medicare Supplement plan, you'll need to get a standalone Part D prescription drug plan as well. And if you go with the Medicare Supplement plan, you also won't get coverage for things like routine dental, vision, and hearing care, which is pretty shocking because your teeth and your eyes and your ears are crucial for your overall health. But for some wild reason, Medicare thinks routine dental or vision or hearing, it isn't medically necessary. That's why people on Medicare supplement plans also sometimes get separate insurance for dental, vision, and hearing, or they just pay for everything out of pocket. But over on the Medicare Advantage plan side, you'll find that most Medicare Advantage plans already have built-in prescription drug coverage. That's why not only are you saving on premiums with Medicare Advantage plans, but you might not need to enroll in a separate insurance plan for dental, vision, and hearing either. Again, Medicare Advantage plans can do this because of how they work. Medicare pays these plans a fixed amount every year for every enrollee or every person who chooses them. And then the plan can choose how to use that money. As long as they cover all the things that original Medicare covers, they can add additional benefits. That's why most Medicare Advantage plans can go beyond original Medicare and offer more than what original Medicare offers. And that's why for this round, Medicare Advantage gets the point. Now, before I go to the last three differences between these plans, let me just jump in here to say that if you're learning something new, please hit the like button. Planning and scripting this video in a way that is not only comprehensive, but is also completely unbiased took a lot of time. And all I really ask for in return is that you like it so that more people can see this vital information. Also, unlike a lot of other YouTube channels, we are dedicated to staying unbiased. So if you want to learn more about the truth of Medicare and make more informed decisions about your Medicare, hit the subscribe button because we have a lot more videos coming out soon. All right, let's get back to the video. Now, if you're someone who has a preferred doctor, you might be wondering if your Medicare supplement plan or your Medicare Advantage plan will cover your visits. Or maybe you're wondering if you can just go to any doctor and get coverage. Well, that's where networks come in. So let's start with Medicare Advantage plans. One reason Medicare Advantage plans are able to provide low-cost health care is because they have a network of local doctors and local hospitals. If you get an HMO Medicare Advantage plan, which stands for Health Maintenance Organization, you usually can't get services out of network except for in emergencies. If you do, your insurance company will not cover the cost of your care, again, except in an emergency. If you have a PPO or a preferred provider organization, then usually you can go out of network, but you may have higher copays if you do. Also with PPOs, if the healthcare provider doesn't take your plan, you may have to pay up front first and then request reimbursement. Now, I could go way down in a rabbit hole about HMOs and PPOs and what's better and who should have which one, but let's just focus on Medicare Supplement versus Medicare Advantage here. And if you want to get deeper on Medicare Advantage, then check out this video that I made about Medicare Advantage. But back to the networks. Most Medicare Advantage plans have local networks. This means that the doctors and hospitals in the plan's network are usually from one city, one area, one county, or one region, typically. That's why in some areas of the country, these networks are going to have a lot of options for doctors and hospitals, but in other parts of the country, usually in rural areas, your Medicare Advantage plan network might be small. Now, on the other side, we have Medicare Supplement plans. And I don't know how many times I've said this already, but Medicare Supplement plans are secondary insurance to Medicare. That means in this context that any doctor or any hospital that takes original Medicare will also take your Medicare Supplement plan. That's why Medicare Supplement plans are so flexible. Most of them don't have networks like a Medicare Advantage plan, and you don't really have to check about whether or not your physician is in the network before you go and get the services from them. You just have to ask if they take Medicare. And also because most doctors and most hospitals all over the country take Medicare, this means that you can essentially get services in other states and still be covered. That's why when it comes to networks and flexibility, this point easily goes to Medicare Supplement plans. When you turn 65, healthcare is not the only thing you're going to have to spend for. And if you retire or lose your main source of income, bills can really start chipping away at your savings. That's why a lot of people are looking for extra benefits, extra coverage, or perks on their Medicare plan. For some people, perks may seem like extras that they don't really need. And it's true that you probably shouldn't choose a plan just based on its perks. But with that said, good perks can actually go a long way in saving you money. So let's start with Medicare Supplement plans. Now, you might be thinking that because Medicare Supplement plans are secondary insurance to Medicare, they're not going to offer any perks. And while you'd be right in most cases, there are actually a few companies that throw in a small number of perks like gym memberships in their Medicare Supplement plan. Now, I really don't want you to get your hopes up on this one because it is pretty rare. Medicare supplement plans offering anything other than original Medicovers is the exception and not the rule. But on the other side, it's quite the opposite. One of the ways that Medicare Advantage plans try to one-up their competition on the Med Sup side is by offering more and more perks. So you'll see things like gym memberships, flex cards, which is money that you can spend for groceries, transportation benefits, or over-the-counter items. You may see meal benefits and sometimes even benefits that help cover your utilities in your home. There are even some Medicare Advantage plans that will actually help pay for your monthly Part B premiums. Now, these perks are not standardized, so every Medicare Advantage plan is going to have a different set of perks, but I think it's clear to see who's getting the point in this round. Now, I've been saving one of the juiciest topics for last. This is because this is the topic where a lot of sales agents misrepresent the facts. And honestly, some of them do this simply because it's easier for an agent to sell you a Medicare supplement plan than it is to help you enroll in a Medicare Advantage plan. But as someone who understands that both of these plans can be good in the right context, I am going to give you some facts about this that you may have never heard before. So with a Medicare supplement plan, there are very few referrals and almost no prior authorizations required. It's pretty simple with the Medicare supplement plan. If your doctor says you need it and Medicare will cover it, then your supplement plan will also cover it. Now, over on the Medicare Advantage side, things are different. When you need to see a specialist, a lot of times you'll need your primary care doctor to make a referral for you. And if you need to have surgery or some other treatment, you may need prior authorization from your insurance company before you can proceed. This can sometimes lead to delays, which can be frustrating. However, there are a few caveats for you to realize, and this is why people who hate Medicare Advantage plans would never tell you. I actually feel very strongly that Medicare Advantage is criminally misrepresented on YouTube. And here's why. First of all, the vast majority of the time, you will get any treatment or surgery through prior authorization that your doctor deems necessary. There is this idea that insurance companies are conspiring to keep you from being able to get what you need. But did you know that each Medicare Advantage plan would literally die off if it doesn't have high enough satisfaction ratings? Literally, if it goes under 3 stars, it will lose funding from the government. So Medicare Advantage plans are actually forced by design to make sure that the people who have them like them. If not, they will just die off. So the most popular Medicare Advantage plans typically have very high satisfaction ratings. The other thing about Medicare Advantage plans in this situation is that your doctors actually talk to one another. What a novel idea, right? See, with a Medicare supplement plan, if you have a hospitalization or something happens to you, when you come out, you've got to tell your doctor what happened. Your doctor doesn't know. There isn't anyone behind the scenes coordinating your care. But with the Medicare Advantage plan, the person who is coordinating your care behind the scenes is also the person who authorizes your prior authorizations and your treatments. Because the person in charge of your prior authorization is not just approving and denying care, they're actually communicating with your doctors and making sure that everyone knows what's happening across all of your doctors. So all your doctors are required, in essence, to communicate with each other. So why don't the other YouTube creators tell you any of this? Well, I can tell you a few things. One is that an agent only needs 1 or 2 days of training to help you enroll in a Medicare supplement plan, whereas it can take upwards of 4 to 6 months to get your license for Medicare Advantage, to get certified, to understand the plans, and to be able to even represent them. Another reason is that when you represent Medicare Advantage plans, you're not allowed to be biased or say certain things that people who only sell Medicare supplements can say. So in my opinion, many of these people who are bashing Medicare Advantage and showing all this bias on YouTube, they have just been very lazy because they don't want someone to tell them what they can and can't do, or they don't want to go through the certification process for Medicare Advantage. So some of them don't even have the ability to represent Medicare Advantage plans at all. So of course they bash them. Okay, I get worked up there. Let's move on. If you want to see an example of the math behind these two types of plans, I have a video where I do a cost comparison that you can check out here. But the truth is that even though Medicare Advantage plans do sometimes require referrals and prior authorizations, the vast majority of people on Medicare Advantage actually love their plans, and it shows in their satisfaction ratings. Remember, there's a reason why 54% of people with Medicare have a Medicare Advantage plan, and that number continues to grow steadily and has been growing for years. Most of the time, these referrals and prior authorizations are really just there so that you don't get expensive treatment unnecessarily. Imagine how many anxious people would see a neurosurgeon every time they had a headache or sneezed. Of course, it's not perfect, so there will be outlier cases where people have challenges and problems with Medicare Advantage. That's why we exist as your agent and your representative to help you through those situations. But by and large, it's a very safe option as long as it's the right fit for you. Okay, but anyway, rant over. I feel very strongly that both Medicare Supplement plans and Medicare Advantage plans have their place in the right context. At the end of the day, this point still goes to Medicare Supplement plans because that's one of the things that you're paying for when you pay the higher premium, the freedom to do what you want, when you want, where you want. Because if you want to get treated without worrying about prior authorizations, that's exactly what a Medicare Supplement plan can do for you. However, just keep in mind that if ever someone is blasting Medicare Advantage plans because of prior authorizations, that person probably does not have your best interest in mind. I actually made a video that breaks down the cost of Medicare Advantage plans versus Medicare Supplement plans in a very specific situation, and that's the video that you should watch next. I'll leave a link for it at the end. So in the end, we have a tie. If you were hoping for a clear-cut winner, you're probably yawning by now saying that this is a boring outcome. But that's the thing about Medicare. There really is no such thing as a best plan. There's only the best plan fit for you. Depending on your situation and your preferences, you will likely find that one of these feels more like a fit for you. For instance, a lot of people living on a fixed income or those looking to save money on premiums tend to gravitate towards Medicare Advantage plans. And there are a lot of people that live on fixed income in retirement. While other people who can afford a higher monthly premium and want the flexibility, they gravitate towards a Medicare Supplement plan. That's why I hope this comprehensive video really helps you to understand the differences between Medicare Supplement plans and Medicare Advantage plans so that you can find the plan that fits you best. I hope that I properly showed you the strong and the weak points for both so that you can make a much more informed decision. Now, if you're ready to go to the next step, then contact our team of licensed insurance agents at 877-360-6565. We'll help you compare the plan options in your area so you won't have to guess anymore. You'll see the actual numbers and what plans are actually available in your area. Best of all, you can get our services at no cost to you. That's right, it is absolutely free to you to work with us. Other than that, thank you for watching, and I hope to see you on the next one. Bye-bye.